What is filaria, and what does the upcoming Mass Drug Administration exercise mean? Filaria in the medical fraternity is rightfully called lymphatic filariasis, but is also commonly referred to as elephantiasis. This is a painful and profoundly disfiguring disease. All age groups are affected wherever filaria is transmitted. While the infection may be acquired during childhood, its visible manifestations may occur later in life, causing permanent disabilities.
Filaria is a disabling parasitic disease caused by tiny worms called filariae. It is spread from person to person through the bite of an infected Culex mosquito. Once the mosquito passes these filaria worms into the body, they then migrate to the lymphatic system where they develop into adult worms. These adult worms then reproduce, releasing thousands of microfilariae. The presence of the adult worms in the lymphatic vessels over time causes inflammation and also disrupts the flow of the liquid in the channels. This disruption causes the liquid to back up and starts to go outside of the vessels into surrounding tissues, producing lymphoedema. Lymphoedema usually affects the legs, breasts, arms, and the male genitals, known as hydrocele. Once the manifestations are evident, it is impossible to repair the damaged vessels. The standard method for diagnosing active infection is the identification of microfilariae in a blood smear by microscopic examination. Blood smears are taken off at night to coincide with the activity of the worms. Once manifestations of filaria are evident, there is no cure to reverse the damage to the lymphatic system. The focus of the filaria clinic is to prevent and reduce disability in affected persons through individualized treatment to destroy any remaining adult parasites and microfilariae, treatment of episodes of acute attacks, management of lymphoedema to prevent progression of disease, and collaboration with rehabilitation services. Surgery for hydrocele. This is done with collaboration with the general surgery departments of hospitals.
In Guyana, the Ministry of Public Health aims to reduce transmission or even eliminate lymphatic filariasis by the year 2022. The country has now adopted to the World Health Organization recommended mass drug administration and campaigns for countrywide elimination. The WHO's global program strategy to eliminate LF has two components. One is to stop the spread of the infection, interrupting transmission, and the second seeks to alleviate the suffering of affected populations, controlling morbidity.
Elimination of lymphatic filariasis campaign, or the filaria elimination campaign as it's more commonly known, is a campaign that started back in 2001 after it was established that most of the regions in Guyana, or actually all of the regions in Guyana, all 10 administrative regions, have transmission of filaria. So the goal of the campaign is basically to reduce the amount of persons who have the microfilaria in their body to such an extent that they're not able to continuously transmit this parasite from person to person. Every year, trained personnel from Ministry of Public Health are embarking on a campaign in which they go house to house, they go to schools, they go to workplaces, marketplaces, other public places, health centers, and they distribute two tablets, DEC or diethylcarbamazine, and albendazole, so that people who are infected by these worms can benefit from from preventive treatment. The campaign has a yearly cost of about $90 million, and this cost is subsidized partially by other funding agencies, such as the Sabin Institute, etc. But that cost is not the biggest burden. Now, even though the medicines that are donated to the country through WHO are free of cost to the country, there is always that thinking that the medicines donated are donated for each and every citizen of the country. So now, when you have people not taking the tablets, that signifies a tablet that could have gone to another person in one of the other 55 countries in the world that are still endemic to lymphatic filariasis or filaria.
Residents in a number of regions across the country will benefit from a mass drug administration exercise coming on stream shortly. Eliminating LF is in keeping with Guyana's role as a signatory to the World Health Organization agreement with other countries to eradicate the disease. The WHO has called for the elimination of filaria using the annual MDA strategy, which has been touted as the most adequate method to prevent such a disease.
When this campaign started in 2001, there was first the Dexalt campaign that a lot of people would have known about, and that was run in all regions of Guyana because it was basically selling salt in the supermarkets, the shops, etc., so that people can protect themselves against the filarial worms. Now, after this, you had the mass drug administration, and that started in the year 2009. In the year 2009, mass drug administration started in regions such as Region 2, 6, and 5. However, we are currently running campaigns in regions 3, 4, 5, and 10 with the intention of expanding to other regions of the country. The campaign this year will start in October, and it will be only in the regions that I previously mentioned. Those would be regions 3, 4, 5, and 10. By next year, we will see the addition of another region, and in the following years, you'll see consecutive additions of other regions also. We choose our regions by the disease burden that exists in the region and also the ease of access of the personnel, etc., to accessing treatment.
Because low coverage has been recorded, MDA is now concentrating on schools and workplaces. It requires commitment from the country to achieve elimination, which means for approximately 5 years, at least 85% of the population must take these tablets once a year. Consequently, new strategies must be developed.
There are quite a few new strategies. One of the strategies that is very new to Guyana, but not to many other countries, is the mass drug administration in schools. We chose schools, workplaces, and other public places because this is where most persons spend most of their time when they're out of the houses, especially during the day when our pill distributors are going around to these places. So for schools, we know that children particularly spend 60 to 70% of their waking hours outside of their home and involved in curricular or extracurricular activities. So we thought that partnering with the Ministry of Education would be a perfect platform to capture these children. Our focus on children goes a little beyond that because our children are disproportionately affected by intestinal worms also, and the albendazole that we share in this campaign ensures that they are free of intestinal worms. Now this helps them to concentrate better in school. It helps them to play with their friends. It helps them to attend school more regularly because they don't have to miss many days from being sick.
campaign is now being offered in schools. The strategy also encapsulates workplaces and market spaces where citizens may spend a great part of their working day. One of the negative features of MDA in previous years was low coverage. Pill distributors reported that in most cases upon visiting homes, there was no one there or not all occupants of a home were present. Meanwhile, pill distributors will continue their house-to-house exercises ensuring that full coverage is achieved in endemic regions, all in an effort to ensure the elimination of lymphatic filariasis.
So in some countries, filaria costs governments in excess of $1 billion yearly. However, here in Guyana, we don't have any data to support such loss, economic loss by the government, but filaria does incur some cost, especially to families and the government of the country. And these costs come in transportation costs, costs for medication to upkeep these patients, costs for rehabilitation services, and also costs for patients who would have been otherwise members contributing to the economy of the country, but because of their disability, so to speak, they cannot contribute. So then the government has to step in and take over those costs.
The swelling and the decreased function of the lymphatic system makes it difficult for the body to fight germs and infections. Affected persons will have more bacterial infections in the skin and lymphatic system. This causes hardening and thickening of the skin, which is referred to as an advanced stage of elephantiasis. The youngest patient currently registered at the Filaria Clinic in Georgetown is 14 years old, while the oldest is 98 years old.
Here I see patients who already have the manifestations of filaria or lymphedema, as you would say, or hydrocele. We would usually educate the patients with lymphedema on care and how to manage. We manage their wounds. Sometimes, they help us out at home. And we do the massage and bandaging of the leg or arm wherever is affected. The hydrocele patients, we treat and refer them for surgery. And once they have taken treatment and undergo surgery, they can live their normal lives. We have some patients whose conditions are severe and they kind of come out. We call them shut-ins. So we would normally go to their homes and visit them. It doesn't only involve the patient of themselves, but you also need family support. Family must play a part in helping these people because they need a lot of support, plenty. Financial support, emotional support, right, which is very important. It's very difficult to get used because you're okay, you're young and you're okay, you have your perfect legs and arms and breasts and scrotum, and then all of a sudden it changes. You have enlarged feet and hands and all that. So it's very difficult to cope with all that without support. So if you get as much family members on board as possible, it helps the person affected a lot.
When I started to get this thing, I get this pain in this foot, this biting, not a heavy pain, but this biting. Then it started to spring like teeny bites, like water. So when I go at the Georgetown Hospital, they didn't want to admit me, but I tell them I can't be admitted because I have to sick husband home. Right? And I beg. Anyhow, they send me home. They think it was a sugar, they bringing out this stuff on the food. But after constantly going for this pain, they end up now sending me to do an X-ray right away, wrong at the X-ray, but not for X-ray. Some people run thing like pour your foot like, right? They give me the tablet, this thing and ease up this pain still there. I had to pay people all for come and help me in the house because I can't go and walk. Pain, biting, day and night, scratch. Anyhow, a lady come to say, go and do a filaria test. And when I tell another friend, he said, you have filaria because the foot on red and I was looking for it swell. Like usually people foot would swell and red. I said, look, I'm going to do it twice, over and over, and it the blood and show no filaria. And the guy upstairs now advised me, said, no, you know what, come and join me, come to the clinic. And when I come at the doctor, I tell the doctor whatever and so on. He said, that is, can you tell me symptoms of the filaria, right? It's some people don't show up at all, but you still have it. And then he gave me some drugs. So since I get these drugs, within 7 days, this thing started drying, and this foot is to stay just and start to ease up with the scratching, with the pain. The second time I come, I tell Miss Cheryl that this foot scratching, she tell me, don't scratch it, wash it every time. So I obey the instruction, and I do it and so on. So it going, so this pain foot is, but I was looking for the foot for swell, but somebody said not everybody foot it would swell and so on, but the symptoms are getting, like the scratching and the biting, and the numbness sometimes and so on. So I tired,
Going through life is very easy. Depends on how you put your mind, how you make up your mind to work it. Once you take it in hand, you won't even see a month, because you're taking on. Once you throw it behind your back and you carry through with life, it's just like a relationship. If you take on a relationship, it's stress. And if you don't take it on, you will always succeed in it.
Although these persons are affected by filaria and much for them has changed, life still goes on. They urge society to embrace persons living with the infection.
You can't stop how people treat you out there, right? But for me, I'm sick with my about 15 years now. I don't have no complaint like sugar, pressure, cholesterol, kidney problem, no problem, right? I feel happy about it. I'm proud I have a sick foot. But people out there don't happy with me because I have a sick foot. They discriminate me. Which in they supposed to be make me more happy because I'm sickly. Because if you go and check a doctor or see a doctor and you hear what you have, you might say, oh, I love him got a sick foot. But what I got will kill me.
I would tell him that, if we had money, people got money and they would buy the sickness, can't buy it. This is everything about, what are they in feel? You understand me? They are they. Like some people got AIDS, some people got cancer, some people got, some sickness, They won't think, I won't feel discriminated. And I said, I won't watch nobody. I come to this clinic and I see people with, so high in this thing. And I would never scan them. I'm a very scarful person. And I won't scan them or watch them with no way funny because, they didn't buy that.
This year, Regions 3, 4, 5, and 10 are targeted for the Mass Drug Administration. These areas have been identified since they are heavily burdened with a number of persons diagnosed with the filaria worm. A more widespread coverage of targeted areas for the MDA is expected to be achieved. Persons in these regions are being advised to cooperate with health workers who will be issuing the drugs during the period of the MDA exercise. Parents will receive permission slips from public schools for their children to participate in this exercise. Pill distributors will be issuing the drugs at homes, schools, government agencies, businesses, and health centers.